Thank you very much for being here today for our first brown bag lunch of the 2015-2016 academic year. I'm Chris Gilchrist-Minicides. I work at the University Service Center, and I'm chair of the Brown Bag Lunch Subcommittee, which is part of the Advising Network. So on behalf of the Advising Network, again, welcome, and thank you for joining us. Today we have Carrie Landa, the Director of Behavioral Medicine and Student Health Services, here to talk with us about helping students in distress. Before we move into the program, I just want to say a couple quick things about the handouts at your table. Save the dates for the upcoming brown bag lunches for the rest of the fall. And if you stay here all the way till the end, you will get a preview of the October brown bag lunch title and description. We have graduate and professional school open houses coming up, so there are cards at your table. There should be at least enough for each of you to take one, but if you need to take a couple more, that's fine. Either grab them from the table or contact Kelly Connors, who supports the Brown Bag Lunch and Advising Network. She'll make sure to get you some more. Please encourage your juniors and seniors to attend. They're giving away lots of cool prizes, really good information for them to have, just a great experience. So thank you for supporting this effort. And I call this the cheat sheet for the case studies we'll do today. Some of you may recognize it from one of the earlier brown bag lunches, but really important advisor resource list. So I put one per table. As we do with all the brown bag lunch materials, session materials, we'll post them to the website, so don't forget to check back about a week to 2 weeks after the session, or look out for Kelly's helpful reminder email, and you'll see all the different session materials and resources available online. I think that's it for announcements, and so without further ado, I'm going to turn it over to Carrie. Thank you, Carrie.
Sure, thanks for having me. Good afternoon, everyone, and thank you all for coming. I am just going to do a quick overview about what we're going to talk about today, and then I'm going to give you guys an assignment right off the bat. Chris had asked me to come and speak with y'all about buffing up our kind of ideas about how we can support students who present in distress. You open up any kind of newspaper, magazine, online journal these days, student mental health issues are definitely in the forefront. It sounds a little bit self-aggrandizing, but I'm so excited to know that so many people are actually interested in supporting students. I think we think of ourselves as educators or people who work with students in res life or athletics, but knowing that people really want to know about resources and best ways to support students, not just be healthy, but be well, is really wonderful. So from the get-go, like I said, you're gonna have an assignment. Every table is gonna get a scenario. If you guys want to just take one and then pass it to the next table behind you. There are duplicates to the scenarios. So what you're going to do is discuss the scenario with your table. You're going to have about 7 minutes to do that, and then we're going to convene as a group to talk about what exactly came up from it. The reason I'm doing it this way, instead of just lecturing to you guys about the different types of services that we offer and how to utilize those services, I think seeing it in action sometimes is a little bit easier to understand that way. So at the bottom of the scenario itself are 4 questions at your table you all are going to think about as you're answering these questions, reading the scenarios. So first and foremost, what resources should you potentially offer to the student, and what resources might you yourself utilize? So who might you consult with, who might you call in? The second, is there any urgency to the situation? Are there any safety concerns? Is the student acutely saying something that really makes you concerned that you actually should take really fast steps on? What are the next steps? So how are you going to manage the situation? And then lastly, what kind of questions come up? So something that, kind of a little bit tangent to the situation that you might think, or if you had experience like this, that there was a little bit of a different twist to it that might be helpful for the group to hear would be great. So I'll give you guys 7 minutes. Exactly, I was told by Chris I have to be very strict on time. If you want to discuss the scenario, if someone at your table wants to kind of take lead and be the one who will give the feedback also, that would be great. All right, so we're going to wrap up our conversations, and now we're going to just talk as a group about these different scenarios. So which 2 tables had the visibly distressed student? The 2 back tables, wonderful. So the scenarios up on the screen. So it's in the middle of a class exam, and a student comes to you and reports that he's having a panic attack. He is visibly upset, crying, and reports that he's having trouble breathing. He states that he cannot finish the exam and runs out of the classroom. What happens? So these are all real case scenarios, just so you know. I don't make this stuff up.
So there are obviously variables that could come into play for the questions, but the first thing was, now you've got a classroom full of students that you can't leave, and you have a student running out the door. So our first thought was maybe see if you could go to the door and call to the student to come back if they're not completely gone down the hall and you can't find them because you can't leave no proctors in the classroom. If you can get a hold of the student and ask them to come back, step outside the classroom where you can still be viewing the students that are taking their exam. But if you can grab a chair, have the student sit down and ask questions. Maybe this isn't the student somebody came up with. If the student knows they're having a panic attack, it's probably not the first time they've had one. So you could ask the student, what do they do in these cases? Sit them down. They probably have coping mechanisms. If the student runs and you can't get the student to come back, and you feel that the student really, there was a sense of urgency and could be in maybe medical trouble, call BUPD right away. Also maybe call your school's student services, who may already know something about this student. If the student has issues with panic attacks, there may already be something that they can help you with. Maybe the student ran out, left the backpack, so you might know how to get in touch with the student. But it was quite a thing, because you can't leave the students alone in the classroom but you've got this distressed student.
Did the other table have any other slants on it?
No.
Good answer, Steve. Good answer. So to your point about it being a medical, was that it, Steve, or is there more?
Well, we did look at it from the perspective of instructors, which we are not, and we assumed that student was gone, away. So focused on the question, is there urgency? Yes, because the student is obviously in distress, and whether it's BUPD or the departmental office or CS advising, making contact so the student can be tracked down, and then make sure health and safety is not a concern. Follow-up, we assumed, was then going to happen for the student through advisors, counselors, behavioral medicine, but then the faculty member also has the resources to follow up in their case there are concerns about, how would I deal with this in the future? How can I negotiate with the student if this is an ongoing, recurring issue? What can I do differently? Once we know everyone's safe, then it's more of a what's the long-term plan and how we would manage that.
So that hits on the resources that you might offer the student. You had mentioned behavioral medicine, student health services. If it truly is, you had made the point, if it truly is a panic attack, if this is something, and this was a student who had experienced panic attacks before, so he knew what he was having, he knew what was going on, he was able to name it. Panic attacks are not life-threatening. If the student is able to manage it himself in the moment, which is what often people who have panic attacks do, but knowing the resources that you can offer the student, if this was a first time that happened to him, being able to say that behavioral medicine is available to help you manage this. If anxiety is a more chronic issue for a student that they need repeat accommodations for something like this, Office of Disability Services would have to be involved in order to make accommodations for the student. Perhaps the testing environment was what triggered the anxiety. Perhaps the actual testing circumstances is what triggered the panic attack. So when it's a longer term plan about how to manage or mitigate a medical issue in an academic setting, Disability Services jumps in. Student health, even though we make diagnoses all the time, we cannot make recommendations to a professor and say, you should give this student a private room to take their exam in, or you should allow this student to do a verbal exam versus a written exam. We are not Department of Education regulations. Student Health Services cannot make those types of recommendations. Those have to come from Office of Disability Services. Okay. Any other questions related to this from the other groups?
What about wellness check for that student? Would that be something that would be? I wouldn't think to call BUCD. I think that would probably
Sure, you know, if there is enough concern for the student, and, you know, I think visible distress can be so varying also. And like I said, if it was something that he had experienced prior, he would know how to manage it. Wellness checks can always be done. You can contact Res Life yourself. Your academic advising department knows how to do that. We are often contacted to facilitate a wellness check, that if it's someone that we might know or that the professor or faculty member wants the student to be on our radar, we could reach out to them. When we reach out to students, so say, you know, Courtney calls me and says, I'm really concerned about this student, can you reach out to him or her? I'll email the student, or one of my staff will email or call the student and say, you know, if we don't hear back from you within 24 hours, or depending on the severity of the issue, we're going to ask for a wellness check. So we kind of give them a little bit of a window to respond to us, so that we're not sending either Res Life or the BUPD in more extreme circumstances to people's doors. Sure. A wellness check is something that's done by various departments across the university, primarily Res Life and BUPD. City police departments do it as well, where they'll just go to an individual to their home, sometimes to their classroom if they're not in their dorm or apartment, to make sure that someone's okay.
And at whose behest does this happen? I mean,
Excuse me?
at whose behest does this happen? I think somebody could use a wellness check, who I suggested, but they usually it goes through different channels.
If there is enough concern, say you get an email, and this will come up in a later scenario, if you get an email about a student that you're really concerned about and you called the BUPD, they would go do a wellness check on their own. We order wellness checks all the time for students that we have high concerns for, but if they miss appointments, for example, we might sometimes request a wellness check. Faculty, I think perhaps dean's level, associate deans, assistant deans, sometimes academic advisors have also requested wellness checks.
I mean, if I have not an acute concern, but a sort of ongoing, this person looks like he's not doing well concern, is that something that I and CAS would suggest or discuss with the advising?
Usually, and then oftentimes advising will contact our office just to kind of consult around what's going on, see if we can brainstorm about what next best steps would be. And if we feel like it's important that we do a wellness check potentially based on information we might have but we can't share, we might do that. Any other hands? Sure.
So if somebody were to call Student Health Services, like you were saying, you know, do you know anything about the student? Does HIPAA apply?
We can't share if we know information about a student. We can receive any information, though. So if you call me and say, you know, I'm really concerned about Susie, she said this in one of her papers, I need to know what we should do, we'll receive any information, and we might talk through what our plan is going to be, but we couldn't verify, we can't confirm or deny, essentially, that a student is being seen by our department unless we have a release of information. So the MIA student. Jamie comes to you and says that she's really struggling with a group project. One of the group members, Sam, has been MIA and has not responded to any of the outreach by the group. Upon speaking with your TA, you find out that Sam has been skipping out on a class regularly. You also notice that assignments have not been handed in since the beginning of the semester. You reach out to Sam and he responds saying, sorry, Professor, I'm really struggling with depression. I'm talking to a doctor, but I'm still pretty stuck. Which groups had this one? So what were your, only one group table had that one? I think I made a mistake with having them. Okay.
Well, we have all the answers, so it's okay.
Wonderful.
Right, Steve? Yes. Yeah. Okay. First, I think we decide that Jamie is not the problem when we assign her to a different group. Second, we've gotten in touch with Sam. I assume this is an email, his response, so we invite him into our office to discuss the matter further to find out what's going on. He either shows up or he doesn't. In either case, we refer Sam to, in my case, CAS advising Steve's office, because they have resources to deal with this that I don't. But if Sam does show up in my office, I carefully sound him out about what's going on, express sympathy, concern, and that somebody is watching and cares. Make clear that the depression is the major issue, and we'll try to come up with ways to deal with the work problem when he gets stabilized with the depression. And stay in touch with advising about what's going on, and try to compensate on the work side once the depression side gets worked out.
So this brings up a really excellent point about academic work that potentially is missed because of a medical issue. Any professor can make any changes to their academic, if someone has their academic requirements. So if someone has an assignment that's due on Friday and they email you and say, I'm sorry, I'm really sick, I can't get it done, I can't hand it in, professors are at liberty to say, don't worry about it, take care of yourself, you can hand it in on Monday. Or conversely, they can say, you have to get it to me today, if you don't get it to me, you'll fail. It's one of the requirements for the class. And I have seen great flexibility and rigidity in terms of what people are willing and not willing to do. If professors are uncomfortable handling these kinds of changes to their curriculum or their expectations for the curriculum, those requests also can go through Office of Disability Services. So if it's a medical issue that's interfering with someone's ability to meet the demands of an academic requirement, whether it's an assignment or attending a group regularly or attending their lab regularly, they can go through Office of Disability Services as well to discuss what kind of accommodations or things can be put in place to help the student still be successful and still meet the requirements that all their classmates are meeting, but do it on potentially a different schedule or have some more flexibility in what the deadlines and timelines might be. Any other things that come up related to that one?
So I guess excuse me, I have two questions. One is, to what extent do we trust what the student is saying? So two questions. Doesn't sound like this is.
It's on.
Is this on?
Yeah.
Okay. To what extent do we trust what the student is saying? So the word depression is frequently used without clinical diagnosis by students, but this student says he or she is talking to a doctor. So do we just leave it at that in terms of that aspect of it, or do we also point this out to Student Health Services that a student tells us this?
Either can be done. I agree, depression is really frequently used, and he didn't say I was diagnosed with major depressive disorder. He said I'm struggling with depression, which is he's entitled to a feeling if that's what he's experiencing. And whether he's being honest about it is a whole other level. Even as clinicians, if someone's telling me I'm already in treatment for this, I don't need help, we have to take at face value what they're saying. One of the benefits with Office of Disability Services is if they are actually being treated for depression and they want accommodations for the classroom setting because of this, Disability Services will actually require documentation from the clinician that's treating them to support the diagnosis so that accommodations can be made. Does that make sense? Yeah. At Student Health Services, we can't say to a professor, this student has depression, we're treating them for this, be flexible on the demands on them. In terms of whether or not we kind of bump this up to Student Health Services, we are always happy, again, to be the recipients of information. So it's potentially we're actually the ones seeing the student. Again, we couldn't share that with you, but it's good that it's on record that he's struggling in a class, that other people in the community know about the student. And if he's not, we can always reach out to the student as well. Something really important here to highlight, FERPA does not prohibit any of this kind of communication. No one in this room, even if you are a professor of psychology, is bound by HIPAA or any sort of confidentiality related to what a student tells you. All of the kind of litigation that has happened across the country related to students with mental health issues, whether it's suicides or required leaves of absences, all of them have been a result of siloing of information. So for example, someone had information about a student, they didn't share it, and there was a really tragic outcome. People who are in the community with the students, so in the classroom setting, in res life, in athletics, none of those individuals have to hold this kind of information when it's of concern. So I encourage anybody, anytime they receive that kind of information that doesn't feel like it sits with what they can do for the student or how they can support the student, to pass it on to people who can.
In short of accommodations through disability services, it seems to me that the ball to keep one's eyes on is whether their students are learning what you're trying to teach them.
Absolutely.
So, if I have somebody who is struggling with depression and tells me about it, I can believe it or not, but I'm still going to grade the work that I get by its value according to me. I'll try to accommodate within reason. But sometimes the the student is going to fail. Sometimes the student really is going to have to withdraw from the class. Sometimes the student is going to have to leave college for a semester.
Absolutely.
It's not my call. That happens elsewhere. But I don't think it's useful to students to bend so much that the consequences of their actions don't play out.
And it's not real world either. You know, when you can't get something into your boss on a deadline because you are sick or because you're struggling, you know, that has consequences to it. And I think, you know, to your point about being sure that students are receiving the education that they are supposed to be receiving without too many accommodations is really important. And different classes, different majors, different sections even potentially have different flexibility. There are some classes where if you're not there every week, there's no way you can catch up. Other classes, you know, I think there was a writing class recently that a student was really struggling, and she was able to do the work after the fact because it was primarily written assignments. There wasn't tons of classroom discussion that the professor felt like she was missing, and it worked out. But that's definitely a call on behalf of the professor that Disability Services takes into account. Yep.
Since this has an effect on other students, and if Jamie says, "Hey, what's up?" You're really not at liberty to say what's up.
Correct. While confidentiality does not apply, respect for people's privacy does in that kind of circumstance. So you can say to Jamie, thank you so much for bringing this to my attention. I'm glad we're able to kind of work with Sam. I'm glad we're able to work with Sam. Are there any ways in which the group feels like they're behind on this project because of this? How can we work to kind of bring you guys back up to speed? So really kind of bringing the focus back onto the group project and having them feel like they're being supported because of this. Okay. Move on to the next one. Okay, the disruptive student, who had that one? Couple tables over here, great. So Lucy, a student in your writing class, has been verbally disruptive in class. You sense that there is something off about the student, but you can't quite put your finger on it. Some of the things she says are consistent with the class discussion, while others are not. The rest of the class is clearly frustrated by her outbursts, as your attention is constantly pulled to dealing with her. You've said to her that she needs to raise her hand to speak, but this has not been done. What do you guys come up with?
We kind of wondered about, I think first, trying to have a conversation in office hours with the student, just to kind of emphasize the behavioral issues and how it affects the rest of the class, to try to put that in perspective. We've had cases like this sent to our office, so coming at it from the staff side, where we've had these students sent to us, and it gets very serpentine and difficult after that, and kind of trying to deal with what should happen next. I think we kind of touched on, am I missing anything? Yeah, trying to connect the student to different resources and the faculty member themselves too, because they can also call behavioral health and see if they're connected to anyone there, if the concern is kind of leaning in that direction, and seeing if the student is aware of things on campus like disability services, if this is anything that they're dealing with overall, and not just like a behavioral problem, but actual condition that they're struggling with.
Mm-hmm.
Yeah, I think that's it.
Who else, other table also had this one? Anything different that you guys came up with?
I think we just really emphasized just talking with the student and really finding out what's going on with this student, if she's ever had this, if anyone's ever talked to her about this before, is this a recurring pattern, and find out if there is anything that has been, in her past that has been either diagnosed or discussed, and try to really get at the root of it and explain really why. Try to get to know her first, and then explain why, you've asked her to come, because help her to understand what her behavior is doing, and the impact that it has, and how we could, and then explain that you want to be able to help, and you appreciate her contribution, but we need to figure out a better way to do it.
I think a couple points that were raised here that are really important to highlight. Focusing on behaviors that are disruptive, whether it's a mental health issue or not, there are a handful of mental health issues that actually might, disruption and speaking out of turn or saying things that are inconsistent with an actual discussion could happen. regardless of what the diagnosis is, it's still a disruptive behavior that needs to be handled as a conduct issue. We can't make something a conduct issue if it's never been addressed to the student. So to your point initially about bringing that student into your office and having discussion, these behaviors, and again, sticking to the behaviors, these behaviors are really disruptive to everybody else. I want to help you feel really comfortable in the class and continue, for you to continue to contribute to classroom discussion. Can you help me understand what's going on for you when you talk out that way? To ask a student, I had a professor ask a student specifically about a diagnosis, and the student was livid. It's none of their business. They don't need to know. It's not up to them to know about my health history. But if you ask them just about their behavior, you're not asking them about a diagnosis. You're asking them, well, why do you speak out loud like that? Or can you help me understand why you feel the need to speak out loud like that, instead of raising your hand like everybody else in the classroom is? I'll get to you guys in 2 seconds. The other part of this, disability services, if disability services were to give the student accommodations, you as a professor or faculty member would not know what the diagnosis of the student is. You would just know these are the accommodations, these are the things that might come up in the classroom, but it wouldn't say student is diagnosed with a spectrum disorder or student is diagnosed with a psychotic disorder. So just in terms of what the student themselves wants to share, they could say whatever they want. But oftentimes there's shame around it or embarrassment around it that the student doesn't want to say to you, this is my diagnosis. So just being careful asking specifically about a diagnosis rather than addressing the behavior itself. The other part of this, we get frequent calls from faculty or staff asking how to manage this kind of classroom behavior. It's really difficult. It's frustrating when people are talking out of turn or interrupting the classroom discussion and interrupting a discussion that feels like it's going well and flowing when you finally get that in a classroom and then someone interrupts it with something that really cuts that conversation off. Those are really important examples to highlight to the student and to keep track of those things, that when you go to, you're reporting a person above you to talk about how do I handle this conduct issue for the student, that these things are really well documented. At Student Health, we can talk with you about how to handle these kinds of scenarios. We can't confirm if the student's being seen by us, if they're getting services through us, but we can talk about how to generally manage behavioral concerns with students in the classroom. Many of those suggestions wind up being, consistency, clear expectations for the student, having one-on-one check-ins with the student to make sure they understand what the expectations are. Some professors have actual contracts with students. I will not disrupt the classroom. I will not speak out of turn. I will only speak when I am called on because I raise my hand. And these things wind up really helping the student actually sit in that learning environment. Hand here and then a hand there. Yep.
I mean, as described, this is a very vague situation. I have no sense of what the disruption is. Simply speaking out of turn, or being obscene, or saying things that are completely irrelevant, or being insulting. I mean, it really could be, a classroom situation is a difficult, it's a complex linguistic environment that perhaps students coming from places where they haven't experienced that kind of environment, they don't know the implicit ground rules. They're trying to learn the ground rules, they don't know, they do the wrong things. Then you have to educate them and make the implicit rules explicit, but that's different from dealing with autism. Could be a whole range of things.
Absolutely, and this presents to us in a whole range of ways. So it presents to us in ways, I remember a few years ago, there was a student who was explicitly making racial remarks in a classroom to a professor who was an African-American professor. The professor felt very threatened by it. It was absolutely a code of conduct issue. The student was brought to judicial affairs, was required to have an evaluation by us, wound up getting services through disability service because there actually was a spectrum disorder for the student that he had throughout high school, and came to BU and didn't think he needed support here. And we wound up figuring out a way to navigate it. Where other students who, a more psychotic student, for example, might say things and go off on tangents about conspiracies or ways that people are impacting him or her, or watching him or her, and the students in the classroom all feel unsettled by that. So that would take a very different approach, obviously.
But there have to be situations which are not morbid, which are not pathological.
Absolutely.
Simply not really getting the rules, because the rules of this kind of situation are not stated at the beginning of every semester. These are things that we assume people know how to behave in this situation. And the fact may be that some people don't yet know how to behave in this situation, and they have to be taught. But that's not a pathological situation.
Absolutely. So in those circumstances, I think, to your point initially, bringing that student into your office, this is what we expect. This is what I expect in my classroom. Students to raise their hands, students to participate in the discussion. Whatever rules you feel have not been explicit or the student might not be aware of, to make those clear. And if they're not followed, then taking the next step in terms of consequences or additional support. The back.
Thank you. So I think on building on that point, one of the first things I would do, aside from talking to the student, would be to reach out either on my own or through a central advising office like CAS Advising to the students' other professors to ask, is this going on in your class too? And that would help us decide if this is a pathological thing or if this is simply a misunderstanding of maybe the ground rules for how discussion works in this particular class.
That's a great point. Consistency in messaging is so important. If one professor has one set of expectations and another professor has another set of expectations and the student is pulled between those two things, it's important that those are clear. In my classroom, this is what I expect from you. Professor such and such might expect something else, but this is what I expect in my classroom. It's important that these students can learn that. To your point earlier, when you're in a working environment, there are rules that are going to be there that are applied that are different perhaps from your home environment rules. So it's important that students are able to learn those things and understand what rules are set in place in different places. Any other questions? Okay. So the last scenario is the desperate email. Alex has clearly been struggling in her classes this semester. You're aware she has support through disability services, but you don't know for what. You receive an email on a Saturday from her, and she states, this just isn't worth it anymore. She then goes on to tell you how much she is struggling academically and socially at BU. Who had this one?
Hi.
Hi.
So we talked about how there's a lot that's unfortunately very vague in this email, that the quote of this just isn't worth it seemed that the fact that that's in quotes made us feel some urgency about it. Mm-hmm. We all felt that we would reach out immediately to the student if we saw the email. The other part of it was that was worrisome was that if it's received on a Saturday, did we actually read it on a Saturday, or unfortunately did we not get it until Monday or some other time or whenever it was. And then since we don't really know the rest of the content, how she's struggling, why she's struggling, is the student known to us or not? We sort of struggled with which services we would try to either reach out to on our own or encourage her to reach out to. But it seemed like there was more urgency in this. We felt that reaching out to some sort of emergency number at Behavioral Health Services, trying to do some sort of wellness check at Res Life, trying to reach out to them. And if it was really bad, or if we felt we didn't get a response from the student or didn't necessarily like the response that came back, if it concerned us more, we would call BUPD in a situation like that. But certainly tried to contact the student ourselves. As the advising staff here, we would try to set up an appointment as soon as we could with the student on Monday morning if we were able to reach out to them. If there were concerns about suicide, if that came up at all, we would likely tell the student that, or say you're reaching out for a reason, you should call the ER, or you should go to the ER as soon as possible. But it was very vague, and it was concerning, and how do you follow up necessarily if you don't hear from the student? When do you follow up? How soon do you follow up? I know I would probably, whether the student responded back or not, I would probably contact the University Service Center, behavioral health, disability, anybody I could on Monday, just to alert everyone that there was this concern.
So I left this vague purposely because this is often what I get, literally, in quotes. Student said, life is not worth it, or this isn't worth it anymore. And then, okay, what do I do? So there is potential that we have information about this student. There's potential the student's being seen in our office, and this is their MO. This is a chronic suicidality, that this is a chronic way that they express themselves, and we're able to have some perspective around the statement that they make. Unfortunately, in the age of technology, which has come to be the bane of my existence, because students now post these things on Facebook, on Instagram, on whatever else there is. There are statements like this made all the time by students. And it is not up to you as advisors, faculty, staff to make a decision about, well, is this, was the student saying that it's not worth it anymore, like doing this assignment isn't worth it anymore, or living here isn't worth it anymore, or being alive isn't worth it anymore? That should not be your decision to have to make, that student health decision or behavioral medicine's decision. So if ever there is any sort of statement like this that has the potential to be a lethal statement, and that has potential, she's saying she's struggling academically and socially. Academic struggle and social struggle are two very, very big markers for suicidality in college students. And she's saying it's just not worth it anymore. Those are three pretty big flags for me. So in that instance, I would call behavioral medicine directly. We have 24-hour on-call with our clinicians being on call all the time for psychiatric emergencies. And that's not just for a student that's struggling. That's also for consultation from faculty or staff that have something exactly like this that they're presented with that they don't know what to do next. We could have information about the student. We might have just seen the student on Friday, and they had sent this email to you on Saturday, and we have, like I said, a context for it. It might be that we know nothing about the student, but we know that the student's seeing someone in the community. So we have other information that we might be able to put some context to this statement. Sometimes we don't, though. And in those instances, we might order a wellness check. We might have an RA through Res Life in a very kind of discreet way go check on the student just to check in with them. How are you doing? Are you feeling socially connected here? Do you want to go grab dinner tonight? We have some ways around without directly saying to the student, I know that you sent your professor this email to find out what's going on with them. Sometimes, though, we do have to say to them, Professor Jones forwarded this email to us. We're really concerned with how you're doing, and we need to speak with you. If we don't hear from you within the next 2 hours, we'll send BUPD to do a wellness check. Sometimes that results in a direct hospitalization if the student is really, really struggling, but we'll make that disposition for you. That should not be something that academic advisors, faculty, staff sit with.
Excuse me. One of the things that we were discussing was whether we reach out directly to the student as well.
Mm-hmm.
Do we with that kind of statement? Because what can we really say to the student?
You could say to the student, I'm really concerned about what you're saying. I'm going to contact behavioral medicine directly so that you could get the support that I think that you need or that you should be getting. You'd also, if you don't want to take the time to do that, because like you said, it could be that you saw the email on a Monday and the email came out on a Saturday. If it wasn't kind of sequential in that way, you wouldn't have to. I think in these moments when there's any potential risk, acting quick and doing what is going to get the student to be safe first and then kind of cleaning up afterwards feels like the most important approach. And oftentimes, very similarly, I get emails on a Saturday. I was grading papers on Wednesday night, and I saw this statement in their paper. I don't know what to do. Well, it's 3 days later. A lot could happen in 3 days. So it's really important when you do feel this kind of information that you have concern for. If your gut is telling you you potentially should have concern for this, go with your gut. Really important.
I think what's hard sometimes for people is that you get a statement like that, and for most people, because you're not thinking in that way, and it's hard to imagine, so it's almost like, oh, they don't really mean this is going to happen. And I think what you're saying, is you just have to not worry about any of that. Mm-hmm. They put the statement out there, and you have to follow through with what you need to do. I guess the worst that could happen is that you'd find out, oh, I didn't really mean that. Much better to have that happen than something really bad.
This kind of situation, if there is a bad outcome, can absolutely result in a lawsuit. I emailed my professor. I told them I was struggling academically and socially. Professor read the email. We know all these things can be tracked these days. Student suicides. We were the holder of information that we didn't do anything about. That's a violation of FERPA right there. Because health and safety, in terms of FERPA, are times when confidentiality absolutely can be breached or privacy can be breached.
And if I could just say, is it on? Okay. From the USC, we hear about this as well from advisors or from students, or they send us emails. And a lot of time, it really is like the student sending out an email, not really thinking about how it could be interpreted, and we use it as an educational opportunity. Folks, think about what you're saying before you hit send on the email to us. And sometimes they're a little embarrassed. Oh, I only meant. And then, how could you think? Well, again, as educators in this environment, we have to be sensitive to this, but it's never a bad idea to err on the side of caution, point out to the student that they do want to be a little more thoughtful before the next email they send, whether it's to a faculty member or an administrator, but it can be a really good opportunity for, an educational opportunity for our students.
Absolutely. So we're going to move on from the scenarios. I know several of you had submitted questions that I tried to incorporate. I tried to pick scenarios that answered some of the questions that folks had submitted, but there were a couple other questions that had come up that didn't fit neatly into the scenario, so I just wanted to be able to address. Someone had asked, and you don't have to claim the questions, someone had asked, how do I delicately manage race issues for students that are highly sensitized about their race or ethnicity? One of the biggest things that I have learned in my career as a psychologist is to not assume anything about people's race. I remember personally, you know, I'm half Spanish, half, you know, like New York Jewish mutt. And you know, someone assumed because I was part Spanish that that was so part of my identity, and were like shocked that it's not more part of my culture. And then I feel like inadequate in some way. Why should you assume that just because I'm part Spanish that I am embracing that part of my culture? You cannot make assumptions just because someone is something. Some people wear their ethnicity and culture more externally, and you also can't make assumptions about that. So being very, very careful about things that you assume about people's race and culture is, I think, blanket message one. When it is apparent that that is something that's coming up for a student, I remember a couple semesters ago there was a philosophy professor that they were talking about race and religion in the class, and of course there was a heated discussion about race and religion, and there was a Muslim American student that was in the classroom, and the student had come to the professor afterwards and went on a tirade to the professor about how insensitive the professor was about the variability that actually exists in the Muslim culture. And the student had an amazing point. I actually think it was really an important point. The way the student approached the discussion was totally inappropriate. He was rageful, he was smacking the desk, he actually broke the professor's glasses. So, what's going on? What is that noise? Okay, I thought something was coming down behind me. Sorry. So, I think those are teaching moments, similar to what Chris is saying. If this is an opportunity for you to teach a student to speak more effectively about something or productively about something, and explaining to them that the way they're behaving, it's not about what they're talking about, it's how they're approaching it. So if a student's aggressively talking about race or religion or ethnicity, to be able to say, I think your message is so important, I think the things you have to say are so important. But it's really important to me that we're able to have a respectful discussion around this, that you're not raising your voice, that I'm not raising my voice, that you're not hitting the desk. And if it does escalate to those kind of things, that's when it becomes a conduct issue like we had discussed earlier. Sure.
What if the student sees everything as a perceived slight because of their race, ethnicity?
Mm-hmm. And that's a real thing, though, and it might very well be that that's how the student experiences that. But perhaps you can even reflect that to the student. You know, what we're talking about this class is not targeted at you. We're talking about generalizations. And, you know, even to make the point, sometimes generalizations are true for some people, sometimes they're not true for others. But it's important to be able to have a discussion as part of a group or as part of a classroom, rather than perceiving that everything is so directed at you. Another question that came up, many students are involved in clinical assignments outside the classroom. How do we know it's safe for them to return to interact with patients or be back in the academic setting? This comes up in graduate programs. It comes up in undergraduate programs as well. I know the School of Education, they have classroom placements. And there are students who are much more open about the struggles that they're having, and then there are students who someone might take a medical leave of absence or a brief medical leave, or in nutrition, for example, the nutrition program struggling with an eating disorder that is very apparent, and there are concerns by faculty and staff about that student being around other patients or other students in their clinical placements. Having, we deal with, and we have dealt with trainees ourselves, and having in our own clinical affiliation agreements, just because of what we do as our work, we actually have a line in our clinical affiliation agreement that was approved by legal that says, if there are concerns about your health or well-being that we see or perceive as potentially impacting the welfare of those individuals in which you're serving, we have the right to request an evaluation by behavioral medicine or by discuss with your supervisor what next steps might be put in place. I encourage you, for those of you who do have clinical students or clinical placements or academic placements, to consider that kind of statement, because it does protect you that if something does come up, you'd be able to request an evaluation. We cannot mandate treatment. No one can mandate treatment. We actually don't provide mandated treatment at behavioral medicine. It's not something that's empirically supported. It doesn't show that it's useful or that there are good outcomes from it. But what we can do is have an evaluation and make recommendations for treatment. If someone from nutrition, for example, is recommending this student who we're really concerned, she looks unhealthy, she looks unwell, she's really emaciated, she's always tired, if they're requesting an evaluation from us, and we make clinical recommendations and the student doesn't follow that, that's grounds for an issue. But if you say, oh, I have concerns about this student, and you ask her, well, what are you doing to take care of yourself? And she's like, well, I'm seeing my doctors. You can't just leave it there. You have to be involved in what the plan and recommendations are going to be that they have to stick with in order to be in that placement.
So how does HIPAA work to know, let's say it's perhaps maybe that situation of disordered eating or substance abuse, and so they have been referred to behavioral medicine. How do we know if they're, because we can't, how do we know if they're complying with what they're doing, with what they're supposed to do as far as being in a substance abuse program or getting help, or
Sure.
if they're, part of it is that before we let you go back to being on a clinical assignment, we need to know that you're getting help and that you're getting better.
Of course. Whenever we are referred a student for this type of issue, so a professor, a faculty member are referring us someone for kind of fitness for duty, essentially, which is what we call it, we get a release of information. So I will say to the student, I'm meeting with you because Professor Jones requested that we meet with you to have a sense of what's going on and to just have a sense of whether or not you're well enough to be doing the work that you're doing. I'm not going to talk with Professor Jones about your diagnosis. I'm not going to talk about details about what we talk about in treatment, but I am going to be able to say to him or her what I think is necessary for you to be able to be well enough to work with the students.
So
That can only be done with a release of information, though. If the student's refusing a release of information, you as a faculty member or as a professor are able to say to a student, we have concerns. We do not feel, based on these behaviors, you're coming in late, you're looking disheveled, you smell like alcohol. We do not feel safe having you in this clinical setting. Until you're willing to do these things, we will not allow you to return.
So is that something, as far as being notified as a professor or someone that's supervising that student, is that notification that we would automatically get from behavioral medicine, or do we request it through the student, or do we call behavioral medicine?
So when the student is, if a
They've
professor is
released it.
calling us or a student's coming, if you're sending a student to us, we would appreciate a call saying, I have concerns about the student, to give us some context and background information. That way, when the clinician sees the student, they can get that release of information to be able to share with you or their supervisor.
Okay, thank you.
Sure.
I think I've been misunderstanding the phrase involved in clinical assignments outside the classroom. Does that mean being treated somewhere for something?
Nope. So clinical assignments in classrooms are, for example, in the School of Social Work, students might have internships where they're treating other patients. In nutrition, they might have practicums where they're doing nutrition evaluations on patients. In School of Education, they might be in a classroom where they're shadowing a teacher or doing curriculum planning. So any placements, clinical placements or clinical assignments that are part of a classroom curriculum.
Does this make them unsafe?
Well, if they have a medical issue, that's potentially putting the patients or students that they're working with in hazard. Sorry.
I thought somehow being in clinical assignment constituted the source of hazard.
No. If there's sometimes it does, but if there's a clinical issue, if someone has concerns about a student, what's the best way to encourage them to access support? Naming a problem. I really recognize that you've been withdrawing from class. I really recognize that your assignments aren't the same quality they used to be. I really have recognized that you're not as engaged in the classroom discussion as you used to be. Is everything okay? I'm all right. Well, there's a great office on campus. You don't have to say great. There's an office on campus that, we have found really useful that students have worked with. Here's their card. Here's their email. Here's their contact information. Here's their website. I put some cards on your table. I think on the last advising network, I'd brought some as well, but I had half a box left. That card has access to all the services and all the numbers that you would need to refer a student to. You could give that card directly to the student. On that card is also our Helping Students in Distress website, which is on the Student Health website's main page. It's a little green icon with two hands clasped. If you click on that, it walks you through how to have these exact conversations with students. I statements, I see that you're really struggling, or your peers told me that you're not participating as much. So you being able to really talk about a behavior that you're concerned about and then offer them the appropriate support. The other counterpoint to that, though, which was one of the other questions that were asked, is how do you talk about anxiety, for example, with students when that's so prevalent in the student population that we see? Anxiety is bypassing depression as the #1 diagnosis in college counseling centers, and we can all guess why. One important thing to be able to say, it's normal to be anxious about things. It's normal to have stress. Stress is motivational. Stress gets us to do things. I would have not gotten through a PhD program if I wasn't stressed every day. I can guarantee you all that. When stress becomes distress, though, that is when it's a problem. When your behaviors begin to change, when your day-to-day functioning begins to change, when you're not sleeping well, when you have no appetite, obviously, when you're having thoughts of hurting yourself or thoughts that are atypical or inconsistent with your normal day-to-day functioning, that's when it's an issue. But to be able to normalize to students, of course this is stressful. Stress can be motivational. Stress is so much about perception. If you look at it as something that's a monkey on your back and is going to haunt you, that's what it's going to be. But if you say to a student, try to embrace this, utilize this as something that's going to motivate you. If it's stressful to you, try to plan out a better schedule so that you could attack some of this stuff with. So being able to normalize some of this stuff for students is really important also.
But I'm not sure that students will listen to us about those matters
They might not.
in the same way that they might listen to somebody who's professionally trained
Absolutely.
to work with them about these things.
And sometimes they don't listen to us either.
No, I understand
Trust
that.
me.
But one of the things I've found in the last few years with some of my students is when I'm referring them up to behavioral medicine, and either they know or I help them understand that it's short-term treatment. One of the concerns that's sometimes expressed is, well, I'm not going to be able to do anything after that because I can't let my parents know about this. So could you define for us what your short-term treatment is? I mean, is that, once a week or once a month for 3 months? Or, I mean, is there some predefined limit?
Yeah, it means a bunch of different things, really. It's really based on what the presenting problem is. Sometimes short-term can be 3 sessions, and the student, after 3 sessions, feels great because it was just related to a breakup. Other times, it's a semester's worth of treatment. There are students who we have seen for 4 years there. We overall have a brief treatment model because we have over 32,000 students, and do the math. But it's not, it's not that we will not get students the support that they need if they need it. When longer-term treatment is indicated or it's something that we feel is what's going to best benefit the student in terms of treatment recommendations, we work with the student. If it's about talking with their parents, that's sometimes the actual treatment. How do you talk to people about how much you're struggling? How do you not feel like you have to be so perfectionistic so that you can let your parents know that you're struggling a little bit? So it would never be that a student is, oh, no, you hit your 3-session limit, no more for you. The last question I hit on a little bit earlier in terms of mandating treatment, which again, we will allow someone to be have a mandate evaluation if there's concerns, but we can't mandate ongoing treatment. Chris, I think, any other questions or comments? Yes.
I had a question related to the clinical assignments. Thanks. Is that the same for professional internships or co-ops, which we have both of them at COMET? There's a supervisor at an internship who reports to us that a student is acting strangely or is having issues. How would we deal with that?
Similarly, if something, whether it's a professional placement or an internship or practicum, there's so many varying levels because we have graduate programs and undergraduate programs. If it's something that's a required part of their academic curriculum in order to graduate or get their degree, it should all be handled that way.
Okay. And I had a question related to the first one as well about the sensitivity to race and ethnicity. We've been getting more and more issues with sexism and misogyny in classes and in assignments and in screenplays that are written and things like that. I was hoping we could just talk a little bit about that, or if we could learn a little bit more about how to deal with issues, if it's directly in class or if it's people who are uncomfortable with content either in a writing assignment or in something like that.
I mean, it kind of opens up a big discussion. Chris, am I allowed to
Sorry.
keep going? It's okay.
Sorry.
Okay. I think when there's any issues that someone is personally feeling attacked, and if there's misogyny or sexism or the question of any of those kind of things, to have an open discussion in the classroom about general respect for other people. So thinking, what Chris had said earlier about the student who just sends the email and says something, not really realizing the impact of the statement that they're making. Very similarly, students in these academic settings say things that they don't realize. One, it's just this developmental perspective that what they do only affects them. It doesn't affect other people around them. But what they do does have impact on other people. It has impact on other people's feelings, on other people's perspectives of them. So to really be thoughtful, and it could even be, are you in CFA? Oh, COM, okay. I thought you said screenplays.
Yeah.
You did?
Yeah,
Okay.
it's
I'm sorry, I was thinking CFA. I remember having this discussion with CFA at one point that in the beginning of all their classrooms where this potentially could come up, they have a discussion about respecting other people. And if there is a sense that they are not respecting other people in their classroom, or if people are feeling threatened by them being disrespectful, that'll be addressed. Judicial affairs, I know it sounds like a crazy leap, is a great place that they will actually mediate discussions with students who are feeling attacked on this level. I had a student who just recently went there, and it was someone who posted something on Facebook that they felt like they were being bullied over Facebook about a gender issue, and judicial affairs was a great place that they could talk through that. If it does become something that the conduct or the behavior of that student is really escalating and not being respectful of other students, that's actually a conduct issue. It's in the student rights and responsibilities that they do need to be respectful of other people. So if judicial affairs is seeing it escalate in a different way, they can take matters into their own hands.
Thank you.
Okay. Thank you for listening to me talk. This is you.
Thank you very much, Carrie, and thank you everyone for coming today and for the great discussion. I just threw up a couple points at the end of Carrie's PowerPoint. I think as advisors, just some important principles to remember that we're not alone in this. We advise students, but we're part of an advising community. So reach out to each other, reach out to the academic advising areas in your school or college. One of the things that I found over the years working with students is the importance of being prepared. So for me, that was just kind of envisioning what are the things I'm afraid students are going to come to me with, and sort of mocking out, okay, it's going to happen at some point, so what can I do now to be ready for it? And for me, that was, who would I call? And distinguishing sort of what are my resources during the workday, or what do I do when I get this email that makes me all sorts of worried, and it's 10 o'clock on a Saturday night, and I knew I shouldn't have been checking the email. So I thought I'd just share a couple. How do I click this thing? This thing? Okay, we just click them through. So you have one, on each table there's one resource sheet, which is just a little bit of an update from something we passed out maybe a year and a half ago. But the information, the exact same information is included in this PowerPoint, which we will post to the Advising Network website soon. But the first set of resources was sort of that medical, safety, behavioral. We have a second slide. I broke out the administrative resources for all of us. And then the very last slide is the academic advising resources. You probably don't need that, but some of you might be like my office, where you're working with a student. I'm not affiliated with a particular academic area. I need all the numbers. You might be working with a student that's taking a particular class, but they're thinking of transferring, and you want to be able to quickly connect with your advisors in another area. And then, just a reminder, we will have the information from this session posted on the Advising Network website. You do need a Kerberos login to access that, but that shouldn't be a problem. And the video should be available in usually it's about 2 weeks. We'll try to get some of the other materials up sooner. And remember, all the previous session PowerPoints and recordings are up there already. And then last but not least, just a quick plug. You've got save the dates for the next 3 brown bag lunches, October, November, December for fall. And here's the sneak peek at our October session on academic integrity. The ERC has graciously agreed to present their Avoiding Plagiarism workshop, followed by a discussion. I think this is a really important topic. We're getting lots of discussion lately on how to help students avoid plagiarism. It brings up cultural issues. It brings up the demographics of our undergraduate population. So I think this will be a really interesting workshop for us, and we can have some great discussion afterwards, so I hope you can attend. And thank you all very much for coming. Hopefully we've stayed pretty much on time. Enjoy the rest of your day. Thank you.